trans people aren't forcing anyone to do anything. Trans people are minding their own business, trying to enjoy their lives, is what they're doing. Mid people. No one's saying that. Right, there was an article a few weeks ago which was shockingly in the Daily Mail and maybe the Tory Graph as well, which was a bastardisation of an article which was written by some academics, some very lovely academics, one of whom follows, maybe even more than one, but anyway, which was essentially a think piece, which is like, is midwife still the correct word to be using? Because we do look after people of different genders, we do look after people who don't identify as women. Now, the word midwife means with woman. It also doesn't really identify what we actually do, because there's lots of stuff that we do. So the theory, the think piece was essentially saying, should we think about a different name? For example, I think it was lead perinatal practitioner or something like that, which basically covers what we do as healthcare professionals. And it wasn't saying ban the word midwife or say mid people. It was saying is it still the right word? Is there a better word that we could use? And it was literally just a question. It was just a talking point. It wasn't saying, oh, you're banning it. But obviously the Daily Mail said, yeah, we're these woke bastards are banning the word midwife. That's not happening. The other thing about birthing people and chest feeding, those are phrases that are often used in midwifery. They're not things that you would necessarily, you're not going to go around and say, if you're doing a handover, you're not going to be like, I have this birthing person. You would talk about them in the phrase, in the way that they would like to be talked about. As I've always said, with anyone that I'm looking after, I will call them the name that they choose to be called. So if your name's Rebecca and you want to be called Becky, I'll call you Becky. If you want to be called Rebecca, I'll call you Rebecca. And if you want to be she, her, I will refer to you as she, her. If you want to be they, them, I'll refer to you as they, them. If you're he, him, then I'll do that. It's just being polite. That's all it is. And if you are a birthing person, then I will refer to you as a birthing person. If you are a birthing woman, then I would call you a birthing woman. It's the same way as before I was a midwife, used to talk about delivery a lot. And I mean, the department I worked in was delivery suite, but there's a lot more kind of discussion about delivery isn't really the right word anymore. It's birthing. Because you deliver a pizza, you don't deliver a baby. So that kind of thing, yeah. It's just about evolving language, and nobody is forcing anyone to do anything. Nobody is forcing women who are not interested in, well, I say not interested, who are gender critical, to be called they, them, or anything like that. It's just about being polite and kind to people, as with all things. Anyway, I don't know if I answered your question, but no trans people are forcing us to do anything. There are lots of academics, some of whom might be trans, but lots of whom are not. People who just want to be kind. That's kind of the point of our jobs. Day one of nursing midwifery school, don't lie in your documentation and be nice to your patients.